Welcome everyone to the Medi-Cal Doula Townhall presented by the Department of Healthcare Services. For today's opening remarks, we have Erica Holmes.
Good morning, everyone. On behalf of the department, I just want to extend our deep appreciation to our doulas, our maternal health care partners, our managed care plans, community partners, Medi-Cal members, and other stakeholders who are joining us here today. Your commitment to supporting Medi-Cal members and their families throughout pregnancy, birth, and the postpartum period is essential to strengthening equitable, respectful, and person-centered care across the state of California. The department recognizes the vital role that doulas play as they bring compassionate, individualized, emotional, physical, and other critical supports to Medi-Cal members and their families throughout pregnancy, labor and birth, and up through 1 year postpartum. Doulas can help to reduce stress and anxiety, bolster empowerment and autonomy, and improve health and delivery outcomes. And these contributions are meaningful not only for members, but for maternal health care teams and facilities as a whole. Today's forum is an opportunity to lift up and celebrate the department's ongoing collaborative engagement with doula partners, managed care plans, and so many others to improve Medi-Cal member awareness of doula services and to reduce barriers to accessing this very important care. It is also a forum for the department to acknowledge that there is still plenty of work to be done in this space and to highlight our commitment to continuing to work diligently to identify opportunities for building upon our prior successes and implementing policies that are responsive to the needs of our Medi-Cal members and our doula partners. Together, we can continue building a healthcare delivery system where every Medi-Cal member's voice is centered, their choices respected, and their care delivered with compassion and partnership. Thank you again for being here this morning, and with that, I will turn it back over to Amber.
Thank you, Erica. Next slide, please. Thank you everyone for joining us, both in person and online. We have a very full agenda today, but before we get started, let's go over a few items. Listen-only mode is currently enabled for those attending via Teams. Attendees will not be able to come off mute, but are able to submit questions through the Q&A function. And we encourage you to do so throughout the presentation. During the last part of this presentation, we'll be responding to questions, both entered into the chat and from those in the audience. Any questions we are unable to get to, we will be taking back and release a Q&A document along with a copy of today's presentation material, which will be posted on the DHCS Doula webpage. Next slide, please. For today's agenda, we will begin with short background on the doula benefit, then moving into updates provided from the following DHCS divisions, including benefits, managed care quality and monitoring, and quality and population health management. Next up will be our doula workgroup members presenting, followed by 3 managed care plans, Kaiser Permanente, Central California Alliance for Health, and Cal Optima. We will finish off with a few spotlight stories and then end with a Q&A session. Next slide, please. First is the background on the Medi-Cal Doula Benefit. Next slide. So Medi-Cal began covering doula services as a preventative benefit on January 1st, 2023. Coverage applies in both fee-for-service and managed care delivery systems, expanding access statewide to culturally responsive doula care. Doula services are available to Medi-Cal members who are pregnant or were pregnant within the past year. Eligibility includes any member who requests a doula or is identified as someone who would benefit from doula care consistent with DHCS standing recommendation. Doulas provide health education, advocacy, physical, emotional, or non-medical support before, during, and after childbirth. Support also extends to members experiencing miscarriages, stillbirth, or abortion with continuous care throughout the postpartum period. Next slide, please. Doulas offer person-centered, culturally competent care tailored to the racial, ethnic, linguistic, and cultural diversity of Medi-Cal members. Doula care supports DHCS' broader aim to prevent prenatal complications and improve maternal and infant health outcomes. Evidence shows doulas can reduce cesarean rates, shorten labor, improve breastfeeding success, enhance satisfaction with care, and strengthen birth equity. Because doula care is classified as a preventative service, federal regulation requires a written recommendation from a physician or licensed practitioner of the healing arts. To streamline this access, DHCS issued a standing recommendation to reduce barriers and ensure members can begin receiving core doula services without additional documentation burdens. I'll now walk through what the standing recommendation authorizes. Next slide, please. The standing recommendation covers the initial set of doula services for any Medi-Cal member who is pregnant or was pregnant within the past year, authorizing 1 initial visit, up to 8 additional prenatal postpartum visits in any combination, support during labor and delivery, including stillbirth, miscarriage, or abortion, and up to 2 extended 3-hour postpartum visits after the end of the pregnancy. The standing recommendation does not authorize additional postpartum visits, but members may obtain a second written recommendation for up to 9 additional postpartum visits. Licensed providers may document this recommendation in the medical record or complete the DHCS additional postpartum visit form for the member. Next, we'll cover how doulas qualify to enroll as a Medi-Cal provider. Next slide, please. So Medi-Cal recognizes doulas with diverse backgrounds and offers 2 pathways to become an enrolled provider: training pathway and the experience pathway. Starting with the training pathway, which requires a minimum of 16 hours of training in doula practices. It also requires an attestation of support at a minimum of 3 births, confirming applied doula experience. Then the experience pathway, which requires at least 5 years of active doula experience within the previous 7 years, and requires 3 written client testimonial letters or professional recommendations demonstrating skills in prenatal, labor, and postpartum care. These enrollment pathways ensure doulas can join Medi-Cal with training or substantial lived experience, supporting a diverse workforce reflective of members' needs. Next slide, please. DHCS maintains an online Medi-Cal doula directory listing enrolled doula providers across the state which have opted to be included. This means not every Medi-Cal enrolled doula provider will be listed on the directory. The directory provides key details, doula's self-report, including specialties, languages spoken, ethnicity, and contact information, all of which supports members in finding culturally aligned and person-centered care. There are close to 40 different spoken languages represented by the doula providers listed on the directory as of this month. Medi-Cal fee-for-service members may use the directory to locate and contact a doula. Managed care plan members should contact their plan's member services who assist with connecting them to doulas within the MCP's network. This helps ensure the doula is contracted, credentialed, and able to deliver services under the member's specific plan. Having a public statewide directory increases transparency, member choice, and access, especially for communities seeking doulas that share cultural, linguistic, or lived experience backgrounds. It also reflects DHCS's commitment to strengthening a diverse doula workforce and helping members and providers identify available support options with ease. As enrollment continues to grow, the directory remains one of the most important resources for connecting Medi-Cal members to doulas and supporting statewide implementation of the benefit. We encourage doulas to opt into the directory to enhance visibility and support member access to care. For those interested, please email the DHCS doula inbox. Contact information will be provided later in the presentation. Next, we'll move into program updates for the benefits division. Next slide, please. So now shifting from background to program implementation, this section highlights key updates from the benefits division, which is responsible for the Medi-Cal Doula Benefit policy. I will also be presenting on behalf of benefits today. I am Amber De La Rosa, Chief of the Benefits Division. Also with me today from the benefits team are Brian Fitzgerald, Raquel Saunders, John Rain, and Molly Vanini. Today's updates will focus on enrollment data, ongoing policy work, operational priorities, and forthcoming updates. Let's begin with the doula provider enrollment trends. Next slide. So doula enrollment in Medi-Cal continues to grow steadily as more doulas join the network. The chart displayed illustrates data from mid-2023 through late 2024, which doula enrollment steadily increased from 123 enrolled Medi-Cal doula providers to 598 during that period. Next slide, please. The data displayed on this slide is a continuation from the last slide, showing increased Medi-Cal doula provider enrollment. As noted, the most recent data pulled from May of 2026 showcases a total of 1,656 doulas enrolled. This steady increase reflects concerted outreach, provider engagement, and statewide efforts to reduce barriers for doulas enrolling as a Medi-Cal provider. DHCS recognizes a robust and growing provider pool, strengthens access, and helps ensure we are meeting the diverse member needs across the state. These growth trends in doula provider enrollment is a positive indication that benefit is becoming more established, as well as a key indicator that increases in access to care for members is occurring. Next, we'll be taking a narrow look at the data from the doula directory. Next slide. This slide displays the county level distribution of doulas who appear in the DHCS doula directory. These numbers represent only the doulas who have opted into the public directory, not the full count of all doulas enrolled as a Medi-Cal provider statewide. Because participation in the directory is voluntary, the figure shown here should be understood as a subset of all enrolled doula providers. The chart in blue, we've highlighted counties with larger populations and corresponding higher number of directory listed doulas. Examples include Alameda County, reflecting 96 directory listed doulas, LA County with 206, and San Francisco County with 136 doulas appearing in the directory. These figures illustrate strong participation in regions where larger provider networks and higher birth volumes exist. The chart in orange, we have counties with smaller populations and fewer doulas listed. Marin and Placer counties each show 40 directory listed doulas. Sonoma County shows 43. These numbers still represent meaningful provider presence and demonstrates emerging networks growth in smaller, more rural areas. The full directory, including detailed listings for all 58 counties, is publicly available on the DHCS Doula Directory webpage. Now that we've reviewed a snapshot of the current distribution of doulas across counties and directory participation, we'll move into the ongoing work DHCS Benefits Division is leading to reduce barriers and improve access to doula services. Next slide, please. The Benefits Division engages regularly with doulas, including reoccurring working sessions with the Doula Core Workgroup, who you'll hear from later today. These sessions serve as a collaborative forum where doulas and DHCS come together to identify challenges, share perspectives, and co-develop solutions that strengthen implementation of the Medi-Cal Doula Benefit. Feedback from these sessions directly informs policy work, some of which we'll cover in the next slide. DHCS has also partnered closely with California Department of Public Health on the release of All Facilities Letter 2513, which is designed to help hospitals better integrate doula services and ensure doula-friendly practices across facilities. DHCS regularly brings concerns shared by doula providers and Medi-Cal members to manage care plans and works closely with plans and associations to resolve barriers. Recent collaborative work includes improving policy clarity related to documentation and insurance requirements for doula providers. This continuous collaboration between doulas and DHCS and between DHCS and managed care plans ensures that barriers are identified and addressed as they emerge, so we can all maintain our collective goal in strengthening member access to care. We will now walk through Medi-Cal Doula Services Best Practices Guide, which builds on much of this feedback and collaboration. Next slide. I want to start by giving a huge thank you to the Doula Core Workgroup and all the doula providers who have worked closely with the department. Your partnership and candid feedback about barriers and challenges have directly shaped the development of the Best Practices Guide. The purpose of the guide is to make actionable recommendations that support access and reduce barriers to doula services for Medi-Cal members. The guide is designed for Medi-Cal managed care plans, licensed healthcare providers, hospitals, clinics, and administrative staff, as well as doula providers themselves. Core principles of the guide include timely access, which is essential. Members must be able to access doula early enough for services to be effective. Members' choice is central. Doula services are designed to meet unique personal, cultural, and emotional needs. And systems and workflows should minimize administrative burdens to ensure equitable access for members. Next, I'll highlight the main topics of the best practices covered in the guide. Next slide, please. So some key focus areas include roles, collaboration, and communication. Doulas are a vital part of the care team. MCPs and healthcare facilities should foster doula-friendly environments and integrate doulas into routine workflows for coordinated, member-centered care. The guide includes recommendations of education for all staff and clear policies recognizing doula's unique role. Next is member access in healthcare facilities. Facilities should have policies that recognize doulas as part of the care team, not just visitors, and ensure uninterrupted access during triage, labor, delivery, and postpartum. The guide recommends a simplified security and check-in procedures, site-specific orientations, and staff training. Next is the managed care plan credentialing and contracting. Recommendations include MCP should streamline credentialing and contracting processes, aligning requirements with the doula's non-licensed, non-clinical scope. Insurance requirements should be reasonable and tailored to avoid imposing requirements meant for clinical providers. Transparent communication, timely reviews, and use of letters of intent or agreements for urgent access are encouraged. Also included as a key topic are provider networks. MCPs should build robust, culturally and linguistically diverse doula networks, ensuring members can access doulas who reflect their background and needs. And MCPs should maintain accurate directories and partners with MCPs should maintain accurate directories and partner with community organizations to identify gaps and support outreach. We have two other key items that will be included in the guide. The next is documentation. Clarification on doula documentation requirements is included. Doula providers must maintain records of service, but policy allows flexibility in format and method. Documentation should be accessible for audits, but not unduly burdensome or require integration into the medical records unless voluntarily agreed. And last key item from the guide will be billing claims, complaints, and appeals. MCP should provide clear, accessible resources for billing, claims, resolutions, and appeals. Timely communication, tailored support, and transparent processes are key. Regular review of complaints and appeals help identify systematic issues and opportunities for improvement. By adopting these best practices, DHCS and its partners aim to reduce administrative barriers, promote consistent and equitable access, and ultimately improve maternal health outcomes for Medi-Cal members. We will now discuss another resource the department is currently developing. Next slide. As highlighted through the Doula Core Workgroup's reoccurring sessions, doula providers have elevated gaps in available resources for navigating complaints and disputes, ranging from billing and claims challenges to credentialing and contracting concerns. We greatly appreciate the time and expertise our doula partners have invested in raising these issues. Their feedback directly informed the best practices guide and DH's ongoing work to improve complaint pathway tools and resources. DHCS already maintains structured pathways for members to submit complaints, but doula providers brought forth a clear need to strengthen provider-facing resources. In response, DHCS is finalizing a new provider resource that will outline complaint and dispute pathways for both fee-for-service and managed care, including concerns related to billing, claims, provider enrollment, and more. Members, authorized representatives, and providers all have the right to file complaints or disputes when issues arise. Using established pathways helps ensure concerns are routed correctly, supports timely resolution, and enables DHCS to identify trends and systematic challenges early, improving accountability and member experience. The next slide provides a visual overview of these pathways. Next slide. These visuals illustrate the appropriate routing process depending on the type of issue the member or doula provider is experiencing. These distinct pathways help clarify where complaints should go and when escalations may be needed. Member complaint pathways are already available on the DHCS website, and a link to the resource will be included at the end of the presentation. Provider complaint pathway resource will be posted publicly once finalized. Using these established pathways supports fair resolution, helps DHCS monitor access, and assist in identifying trends that may require policy or operational adjustments. Both the Best Practices Guide and the Provider Complaint Pathway resource are undergoing final internal review and will be made available on the DHCS webpage in the coming weeks. I will now transition the presentation to our Managed Care Quality and Monitoring Division, who will discuss additional implementation updates. Next slide.
Good morning. Thank you, Amber. My name is Jessica Harris. I am a health program specialist too, working in the Managed Care and Quality Monitoring Division. And we work with the Medi-Cal Managed Care plans to address barriers and provide guidance surrounding doula services. I, along with Jillian Clayton today, will be presenting on the process for doula enrollment with the Managed Care plan, payment with the plans, provider dispute resolutions with the Managed Care plans, and updates that we are in progress with the doula all plan letter, also known as the APL. Next slide, please. So just a little overview of enrolling as a doula. So the first step to becoming a doula Medi-Cal provider is enrollment. And doulas may apply for the enrollment through the DHCS provider application and validation for enrollment portal, also known as PAVE, to become that Medi-Cal provider. When enrolling, doulas will need to register for a national provider identifier and NPI to enroll with DHCS. Furthermore, federal and state laws do require individuals to submit their social security number in order to enroll as a Medi-Cal provider. If a doula is interested in serving Medi-Cal members within a Medi-Cal managed care plan, the doula will need to contract with each of the managed care plans operating within their service area. MCPs are required to verify the credentials of their network providers. So this may include appropriate license or board certifications or registration and professional association memberships as applicable. Once credentialing is completed, MCPs can then contract with the doula providers, which is the written agreement between an MCP and a network provider. And so we know that there has been a little talk around the limit and requirements with regards to insurance requirements, and we will be addressing that a little later in a later slide. Next slide, please. Oh, looks like you guys had to. Next slide. So a little bit on the contracting updates with the Medi-Cal managed care plans. As of April of this year, our MCP survey data shows that there are 1,273 unique doula contracts. This number reflects the number of individual doulas as well as doula organizations that have contracted with managed care plans. And this is the number in the orange. This number does include providers who have contracted with more than one managed care plan. Overall, the number in the blue reflects the executed number of contracts. So as of April, we have 1,866 doula contracts statewide. This number does include doulas serving in multiple counties with an MCP, as doulas in multiple counties were reported separately, and doula providers contracting with multiple MCPs. So since the beginning of implementation, there has been an increase with the amount of contracted doula providers. Next slide. So I know there is a little bit about doula reimbursement and payment when it comes to a managed care plan. So effective January 1st of 2024, DHCS increased the Medi-Cal targeted rate increases, which is also known as TRI, for maternal care services, which includes certain doula services such as prenatal and postpartum visits and supporting during labor, delivery, miscarriages, and abortions. And so TR rates are provided to providers who are contracted with the managed care plan. At times, these rates do not apply to providers working under a letter of agreement or a one-time agreement. And for reimbursement purposes, MCPs must follow the timely payment of claims outlined in our APL 23-020 for paying a clean claim. What constitutes a clean claim is that it has no provider corrections or additional information in order to be paid. So if a managed care plan does not pay a clean claim within the 45 working days of receipt, it will owe the provider interest at the rate of 15% per annum beginning on the first day after a 45 working day period. And if a doula is experiencing issues with a payment from an MCP, they may submit a provider dispute with the health plan. And I will turn it over to Jillian Clayton to discuss that on the next slide.
Thank you, Jessica. So contracted network providers have a right to address their concerns about timely payments by following up through their applicable managed care plan's provider dispute resolution process. So providers may submit a dispute for the authorization or denial of a service, the processing of a payment or non-payment of a claim by MCPs, the processing of retroactive rate or payment adjustments pursuant to the terms of a state-directed payment or other payment policy that is contractually required, or the timeliness of the reimbursement on an uncontested clean claim and any interest the MCP is required to pay on claims reimbursement. Next slide, please. To address concerns with the plan, the provider would initiate a complaint through the MCP's provider resolution process. And for any other issues, if the provider is unsatisfied with the outcome of that provider dispute process, you may file a provider complaint directly to the Department of Managed Healthcare at Provider Complaint Unit at dmhc.ca.gov or via the complaint line toll-free at 1-877-525-1295. Next slide, please. So DHCS is updating new guidance through the APL 23-024 to provide guidance to MCPs on the qualifications for providing doula services. The revisions to the APL will address new requirements for MCPs to enter into a letter of agreement with an out-of-network provider if the member identifies that the network providers do not meet the member's racial, ethnic, or cultural needs. The updates also address new guidance for professional liability insurance, workers' compensation, and other insurance requirements to reduce barriers. And lastly, the changes include limitations for MCPs to require specific documentation from doulas or for doulas to integrate documentation into electronic health records. These changes will help reduce barriers and address challenges that we have seen and heard of in implementing the doula benefit. And lastly, before I hand it off, again, I just wanted to give a huge shout out and thank you to all the doulas and others who shared their feedback with us. It was your voices that directly shaped and influenced these policy changes that are coming out in the APL, and truly none of this would be possible without you. So on behalf of the department, we are grateful for your continued partnership. Thank you so much.
Thank you, MCQMD, for the updates. Now we'll be passing it to QHED.
Thank you very much. Good morning, everyone. I'm really happy to be with you all today. My name is Jennifer Maucus, and I'm the nurse consultant on the Quality and Health Equity Division's Maternal Clinical Focus Area team. I'm happy to be part of the mighty maternal team that consists of Dr. Anna Catillo, Harinder Batal, Lucy Lohr, and our fearless leader, Dr. Leland Swayfer. Next slide, please. So just a little bit about the role that our divisional team plays within DHCS. We really work with our managed care partners, our Medi-Cal managed care partners, as well as our county behavioral health plans to help support quality improvement. So we hear from different plans the innovative strategies they're deploying to make positive improvements in the healthcare of our Medi-Cal members, and we spread that information to other plans. We promote collaboration between MCPs that are all sharing the same county or service area, and we really work towards providing clinical and quality improvement expertise throughout our DHCS different divisions. One of the most important areas that we're working on currently, as well as in the past few years, is the birthing care pathways and those 42 policy improvement areas to expand maternal health care and reduce disparities. Next slide. So more about the work that we're doing in collaboration with all of the wonderful work you've heard from the benefits team, as well as the Medi-Cal Quality Monitoring Division, or MCQMD. Amber talked to us already about all the positive impacts that doulas can have on the health and well-being of our members and their infants. We still know there's work to do and want to help to support the expansion of utilization of doulas throughout the state. So what we're doing along with benefits and MCQMD is we're learning about what is, what is happening in our state as far as doula utilization. We're doing internally an environmental scan and root cause analysis to see how we can support, along with other divisions, the utilization of that benefit. Next slide. So what we're doing is, next slide, please. We're really looking at, how can we support all of the good policy work that is occurring and help support the plans in the implementation of the new APL interventions, as well as listen to the doula. So we're doing currently some doula stakeholder interviews with the Medi-Cal managed care plans, as well as doulas and doula hubs. We're working and listening with our different teams internally. Dr. Coutillo has been attending the doula work group meetings for a long time, probably since at least the implementation meeting started. We recently sent a survey to the Medi-Cal managed care plans, and one of the areas that we're looking to find more information about has to do with doulas and how that's going. And so we're going to use all of that information to really help us inform some work with our Medi-Cal managed care plans and our internal partners to hopefully help support the doulas in serving our members. And I'm going to pass it back. Thank you.
So much, QHED, for the updates. We will now be moving to our doula work group members presentation.
Thank you so much. We're so glad to be here. We've come such a long way, baby. What a great time to be alive in this moment with all of you. And we really want to thank all the doulas who are out there who have chosen to lean into this incredible historical benefit and be the advocates and the activists and the community agents of change. Your voices have centered this movement, and we're so grateful for DHCS to collaborate with us and to respond to all of the suggestions and the reflections. Next slide. Welcome. We'll just swiftly go through these slides for this beautiful DHCS Townhall Medi-Cal Doula Benefit. Here's our co-design team presentation. You'll hear from several of us, and I'll begin with the next slide. Just a very quick glimpse at the beautiful members of the doula co-design team. There were so many members of the co-design team for managed care plans and hospital associations and a national health law and various other allies that came together to co-create this benefit. As you see here on this slide, we have Dr. Saida Pepper Wilson, myself, Carefree Riley, Mama Linda Jones, Mama Samsara Morgan, Chantal Reynolds, and Kairos Joy Coulter Chiagi. Next slide. Here we are in Sacramento, the doulas of the co-design team, wanting to acknowledge those original members that included at the time Paisha Edwards from Expecting Justice. And in 2024, we were joined by Chantal Reynolds and Kairos Chiagi. Next slide. You can see this beautiful, happy smiles here when we came up to Sacramento to meet our incredible colleagues at DHCS who helped birth this benefit, and also here at the California Black Birth Equity Conference, where we were asked to do a panel to present about the birthing of this benefit. It truly has been a community effort. And as you can see here, we're very happy with what we've created, but there's so much work to be done, and we're here for it. Next slide. This is me, Carefree Riley, co-founder and executive director of Frontline Doulas and director of impact and development of the LA County Medi-Cal Doula Hub. Greetings to all of you here, our community and colleagues and stakeholders. We deeply appreciate your collaboration, and we thank DHCS for the consideration of all of the recommendations reflected in the various updates in this town hall. And while progress has been made, there's so much more to do. And so we are grounding in and sticking to our guns, standing 10 toes down, and continue to do this work together. Recognizing that every community has its own unique needs, this is certainly not an exhaustive list, as we'll all be bringing up different topics. We urge stakeholders and decision makers to address these key concerns. One is lower credentialing barriers that still exist and commit to data transparency, to establish flexible letters of agreements or LOAs, and invest in community education on the benefit, and also robustly fund community-led and centered doula programs and organizations. But I wanted to speak a little bit about overcoming some of these barriers and realizing the promise of the Medi-Cal Doula Benefit. And want us all to remember something as we begin today, that doula work did not originate with a Medicaid benefit. It did not start within the walls of hospitals, nor was it defined by administrative policies and procedures. Long before any of that existed, it lived in the simple act of supported birth upon the earth. It thrived beside the hearth, within the home, inside sacred family spaces, and in humbled kitchens. Birth work was practiced on front porches and in rocking chairs, passed down along dirt roads and through the gentle hands of grandmothers into the dedicated care of the community. So today we face a maternal and infant health crisis demanding collective courage. And I think really transporting us back to the strength of those ancestors, those foremothers, those forefathers, and the great community agents of change that got us here to this moment, and act with that and with that legacy in mind. The Cal AIM goals challenged us to close the maternal care disparity for Black and Indigenous birthing people by 50% by 2025. Yet in 2026, rates remain unchanged. In Los Angeles alone, 9 African-American babies out of 1,000 die in their first year. Families are torn apart, which we cannot allow to continue. And that's why we get up every morning to do this work. We know that doula care works. In Frontline Doulas 2022 California Community Doula Pilot, we saw 0 preterm births. That's 0. And we cannot allow anything further to harm the mothers and the children of this state when we know that doula care works. Well, we seem to be facing this paradox of access to safely care for our communities. We need thousands more doulas and midwives. And it's really great to see the numbers that were reflected on the slides today, but we need more to safely care for our communities. Yet less than half of the contracted doulas are utilized due to lack of benefit awareness. So there are numerous systemic and administrative barriers that are choking this benefit. We are fighting a battle still in the clinics and hospitals. Pregnant individuals are being told by clinical staff that a doula is not necessary. The credentialing process is broken. It's designed for clinical medical providers, not community-based workers. Multiple bureaucratic hurdles intimidate passionate, qualified doulas and keep them out of the network. And finally, we must talk about letters of agreement or LOAs, which was mentioned here in the slides previous. When a pregnant person in the 3rd trimester enters care and already trusts an out-of-network doula, They deserve continuity of care. And right now, extreme delays in barriers contracting and approving LOAs mean doulas are forced to either abandon families in crisis or work for free. And forcing Black, Indigenous, and community caregivers to perform unpaid labor is unacceptable. And we'd like to see that change. So we call on leaders to simplify credentialing and using PAVE as the standard and remove irreverent clinical requirements, to prioritize immediate LOAs and treat out-of-network requests as urgent to ensure continuity of care, to publish live metrics to increase transparency on credentialing and contracting in efforts to build community trust, and to provide robust funding to community-based organizations to cover overhead expenses and ensure the prompt processing and payment of claims. It's really time to move beyond the box checking and the, all the little itty bitty tiny bureaucratic things that are happening that are really creating such a huge barrier here for families to access the care that they deserve. So as we move through the slides, please join us in advocating for families and doulas. And the following slides, which I'll go through very quickly, detail our requested metrics and various community actions you can engage and activate with. So thank you all for stepping up to the plate and helping us move this forward. Next slide. Here's a data request from MCPs for doula credentialing and contracting for statewide transparent shared metrics, addressing the community's request for all MCPs to show live metrics or shared metrics for enrollment updates, specifically the numbers of requests for contracts. We know doulas are reaching out. They're requesting being contracted, and they're having a hard time getting communication back and not knowing how long it's going to take. The number of applications received and begun, the number of returned applications, the number of pending applications, and the number of complete applications. This was inspired by New York State that also had public shared metrics for contracting, billings, and claims, etc. Next slide. These are some of the doula community the advocacy resources that was shared by wonderful people here at DHCS. We wanted to make this easy for doulas to access here and anybody out here on this call, especially Medi-Cal members, with their QR codes for the managed care plan members and the QR code for the fee-for-service members. Medi-Cal members' voices are key to advancing this benefit. We need to hear from you if you are not getting access to the doula that you require, that you want, or that is culturally aligned to you, or that meets your specific needs. If you're having challenges in clinics and hospitals and being denied care and or mistreated or experiencing obstetric violence, etc., please communicate this. They want to know. We need your voices centered, and doulas can help your clients file. Next slide. Here's a wonderful website that's been created in a community action and advocacy letter here. You can scan this QR code to go to protectdoulacare.com, where we believe that families on Medi-Cal have the right to a doula of their choice, where over 330 signatures were collected, 120 Medi-Cal members, 50 plus organizations across every region of California. Next slide. The organization behind this, as you can see, this is just some of them from the convening partners, from Frontline Doulas, Diversity Uplifts, Black Women Birthing Justice, Beauty for Ashes, Better Birth Oakland, Kindred Space, Birth Workers of Color, National Health Law, Roots of Labor, Sankofa, and the Sean Collective, and so many others here, community health orgs, legal advocates, and care providers across the state, including Medi-Cal members themselves. Next slide. We know there's this active maternal and infant health crisis, and although at managed care plan site lack of demand, that number is very misleading because most California families have never been told they have a right to a doula, or that doula care measurably improves birth outcomes. So there can't be a real demand for the benefit that families don't even know exist. And we know babies don't wait, they're gonna come, they're gonna be born, and families can't wait to get the support of a doula, midwife, and a really full, true, collaborative, compassionate care team. So we welcome you to go to this website and sign and join and learn about the advocacy efforts that you can participate in. Next slide. I just want to say quickly one of the quotes here from one of the doulas to show you the real voices. There were over 130 comments that you can read on the website. A doula says, "I'm forced to turn clients away due to managed care contracting barriers, even though I'm fully qualified to support them. This creates unnecessary stress, delays care, and disrupts trust at a critical time. The system shouldn't block access to care that already exists. 2 years waiting to be contracted with several MCPs is unacceptable. I've had to deny support to birthing families because of these barriers. This is unacceptable in the crisis that we're currently having in California." Next slide. So our requests are honoring the right to choose a doula of your choice, remove contracting barriers immediately, pay fairly and on time and cover administrative costs, and drop unrealistic rules, adding transparency. Next slide. Babies don't wait, families don't wait. Please join us. And I'll move swiftly to the next slides as we close this section. I pass it on to my colleague. We want to invite all doulas here to come to the California Doula Access Workgroup and listserv to sign up today. We meet monthly on the second Thursday of every month, where you can join advocacy actions, share what's happening in your community, learn more about the California Medi-Cal Doula Benefit and expanding equitable care across California. So please join us, scan the QR code, sign up. And this is only for doulas, and we look forward to seeing you and being community with you. Next slide. DHCS has worked with us on this. This feedback form was created by independent advocates, Roots of Labor, Frontline Doulas, and NHELP. And you can see here, we asked for doulas. If you're having problems or challenges, those doulas here who have submitted over the form, you might think, what's happening? You see all the work that's been done today and presented by DHCS. That's what's been happening. Your voices have mattered and have made change. If your families or any families on this call want to support, report any problems or challenges they're having accessing or receiving doula care or anything in hospitals or clinics, please report that here. We have utilized this, they have listened, and we really need your continued engagement. Thank you so much. Next slide. I'm honored to present Dr. Saida Pepper Wilson, Executive Director of Diversity Uplift, Inc. Dr. Saida, so glad to hear from you. How you doing?
Yay, thank you so much, Kefri. That was a really great summary of so many things. I want to take the time that I have this morning to lift up a number of the organizations and agencies and just have people remember that as much as DHCS has done their process and the managed care plans are doing, their thing, what is actually getting doulas enrolled, all of those numbers that we saw of people who had started off in the hundreds and now are in the thousands. Most of them are being handheld by community-based doula organizations and, the original pilot holders of the benefit before it was a benefit, right? When people were saying, how can we get doula services available for free to communities who really need them? A number of community-based organizations and birth leaders and really passionate people who are wanting to see something available that wasn't there, put time, volunteer hours, have requested for funding over the years, beyond 5 years, but around about a little bit before the pandemic, some of the pilots came on. So I just wanted to remind us as we keep moving forward how we started and that people are still using those resources. They're still going to the people who train them to say, hey, I want to be a Medi-Cal doula. And that means that if that workforce is being really built and supported by community-based organizations, people need to remember to continue to pour into, to fund, to resource, and to lift up the organizations that have been doing the work and also got us here with the advocacy. And of course, we know there are intermediaries, there are organizations that are, large health systems that are also lifting up ways to incorporate doulas into their system. And when we will see that. But if you ask the doulas that are enrolled, even in some of those groups, how they got to this conversation was a lot of the community-based organizations that may or may not have like a billing solution or may not have their own sort of business relationship with the managed care plan, but they're getting doulas to even organizations that can take them the other way, right? So there's a lot of paths that we're choosing in California to operationalize the doulas that are in our community. Some of them are going to be handheld and continue on all the way through to a relationship with the managed care plans and DHCS, and others are going to be sparked and created and lifted up and then handed off to those that have capacity to do that. And so just, as people are thinking about setting up supports, I want everybody to think, is there a community-based organization in my area that's already supporting doulas? Where did these doulas come from? How did they hear even about this? And if they came through through a community-based organization or individual, think about how to loop that person or that group in, how to fund them, how to make sure that, because something that DHCS brought up in the beginning was that the idea of a doula was that people would have culturally responsive and community-based care. But where do people live in community and within their culture? How do they hear about things? They hear about it from within the community. And so this workforce ideally is never going to be some overly medicalized workforce that is created by the medical system, because that would mean that it's not coming from within the culture where people are living, where people are birthing, where people are bringing babies back home to, where families are, coming up with their plan to expand their families. That's happening in homes. And we're in their homes and we're their neighbors, right? And so I always just want to make sure that as much as we are excited about this benefit being available to people through government payment, which if people are getting healthcare and the government is there to support, the ecosystem of health, then this would be included. And we're happy that this is an option financially, but we don't want it to lose its organic and what was evidence-based was this person that is connected to you being with you. So with that, you can go to the next slide. I wanted to just remind folks of some of the original organizations that had pilots that were the evidence that was pulled to say this would be valuable for California to have a Medicaid and a Medi-Cal benefit. I'll just do them in order of what I'm seeing on my screen for a second. But Her Health First in Sacramento, having a doula program that was a pilot with a health plan up here. And then Sister Web, I'm actually going in a different order because I have notes about the things that folks are doing and then what they're doing now. So Frontline Doulas and Diversity Uplifts, and that's Kefri and myself and our collaborative relationship between Frontline Doulas and Diversity Uplifts from the start, had pilots with HealthNet and Blue Shield. And HealthNet had the first pilot for doulas to serve this quote unquote Medi-Cal population to see how could this work and what's valuable. So shout out to the health plans that started those pilots and that were willing to invest early on before there was, receiving money from the federal system for this. And now Frontline Doulas and Diversity Uplifts in partnership with Los Angeles County have the LA County Doula Hub, right? So we started off having doulas in the community, identifying folks that wanted to serve their own community, got them together, organized, worked with a health plan to come up with a pilot, served families over years, proved that it works, that it's valuable. And then thankfully we're able to be a hub for our region in Los Angeles County and beyond, because folks are serving Los Angeles who live in many of the surrounding counties, so that we also now can take people along the road toward becoming Medi-Cal doulas. So, shout out to all the folks that were involved, all the doulas, our original frontline doulas who that was named after because they were on the front lines of birth work in our experience during the pandemic. And, their whole presence named themselves. Then we have Sankofa Birth Workers Collective, who also, who supported in having a PEI, the PEI programs, Perinatal Equity Initiative. So shout out to all the PEI programs, because in all the counties, I believe it's 11 counties that have PEI, most of them chose Doula Services. People know about doulas in community because of these programs, right? And so where they continue to exist, some of them may have sunset, but we just want to, shout out to all the PEI doulas out there. And in particular, Sankofa Birth Workers Collective, out of that, Chantel, who's sitting next to me and we'll talk later, has the Doula Lab. Deidre Consumpos Medley has Grounded Beginnings, doing doula trainings. And so there's been all this expansion continuing on in that work. The AIM doulas, and I'm still saying with SoCal, AIM doulas in Los Angeles have had a number of doulas over the years with the county, and now they also take Medi-Cal, and so those doulas are available to the Doula Benefit. Sister Web, going to the northern region now. Sister Web had their doula programs also through PEI and other their own independent initiatives. They now have the Sister Web San Francisco Doula Hub. So there's another doula hub now that's on the scene. If you're in the Bay, check out Sister Web. Birth Workers of Color, going back to SoCal, have had trainings for many years. People have done Birth Workers of Colors trainings. Now they're taking many doulas who want to go into the Medi-Cal world into that. They are a Medi-Cal provider and group themselves, and so they've taken that on. Shout out to Birth Workers of Color. Black Women Birth and Justice, going back up to the Bay. They've had trainings for years. They've been supporting doulas through enrollment in the benefit. And now they also are having a billing portal to support the doulas to do their own billing in collaboration with the organization. Oakland Better Birth Foundation, training doulas and supporting them, also helping people on their Medi-Cal journey. Roots of Labor, many trainings over the years. If people know that they hold down the people that are incarcerated in Santa Rita jail and have really been doing great work with that community, but they also have a community out of a prison work where they've been helping people enroll in Medi-Cal, and they've been doing a lot of doula advocacy in this work as well. I talked about Her Health First at the beginning. Just want to note that Kairos, who's also on the co-design team, was the doula for that pilot. So when they came on with that pilot, we had like 8 doulas or 12 doulas or something in our Southern California, and Her Health First had Kairos. So Kairos held down the Sacramento program and now also supports doulas through the Children of the Sun program, which you'll talk about. So the last thing just to share, as I've been Saida Pepper Wilson in the mix for all these years, the thing that is not lost upon me, because I'm a people person, always the one getting in trouble talking in the back of the room, is that there's so many people doing things. And I want everybody to know what everybody's doing. I want all of us to play in the sand together. So one of the things that I did early on was create a website where I could just store all of the things that everybody comes up with, because we're so magical. Every year, every month, somebody's coming up on a new way to help doulas get through the Medi-Cal. So I'll put it in the message board so that folks can see. You can go to the next slide. So this is the website. You could go to the QR code. It's there. There's a section under Find Support. So if you want to know, all these organizations and a bunch of other organizations that I didn't mention, people have local efforts. I'm asking for folks to send them to me so that I can add them to here. It's a free available resource for anybody. It's co-brand, it's created by you. If you have a thing, we're going to post it. And so I just wanted folks to know that there's a way in the meantime, while we're all connecting and all the social media, everybody's not on the same threads. There's too many things. At least there's one place that you could go that I could share when I know anything. Chantel is also helping me. A number of folks are helping to support to make sure that we can keep that updated. And that's it. Thank you so much.
Hello, everyone. I'm Mama Linda Jones. I'm Executive Director and co-founder of Black Women Birthing Justice. And a lot has been said already about what we've been doing with doulas, but I just wanted to mention what we're doing here at Black Women Birthing Justice to help this wonderful profession of doulas become a thing. I've been a doula myself, a birth and postpartum doula here in the Bay Area for over 35 years, and I know this is an amazing profession, and I want to help other people get into it. I've been on the stakeholder group to help design the bill, and when we got done with it, I said, well, this is sweet. We made a really good bill, but who's going to do this? Because there's no doulas right now that are providers. So my goal was to train 100 Black doulas to become Medi-Cal providers. And as of this year, we've trained 118 of them. So we want to try to get those people signed up with managed care plans. We've been working very closely here with Alameda Alliance, which is our managed care plan for this area. And they've been very receptive, and they're one of the managed care plans that is doing the right thing for doulas. They listen to us when we tell them that the contracting system is too convoluted for doulas to get through. They've redone their contracts, so it's just doula specific, which I would wish other managed care plans would do around the state, instead of having a 90-page generic contract that doulas have to get through that is made for medical people. So we're working with them and trying to streamline the credentialing and contracting part of this for the doulas here in the Bay Area. We've also created an amazing client management portal that also does billing. And we want to share that with anybody in the state who wants to have that kind of thing for their doulas. It's a HIPAA approved, contained portal where the doulas can keep all of their information. They can keep all of their appointments. They can interface with their clients. It's an amazing system that we developed, and you'll be hearing more about it, I'm sure. I don't want to keep us any longer. I will pass it off to Sam Sarah if she is here. Thank you. I'm not sure if she could get in to talk.
Hi there, can you hear me?
Yes, go ahead, Sam Sarah.
Praise God and goddesses, all of them together. So yes, I am Samsara Morgan. I am the founder of Better Birth Oakland, formerly Oakland Better Birth Foundation. And we are working and starting to step into the role of a doula hub for the Oakland East Bay area. We're going to do a lot of what has already been said here by a lot of other wonderful people about bringing more information to folks about the Medi-Cal Doula Services. And my particular point of view is looking at doulas in doulas as a whole, not just the Medi-Cal doulas, but those who are wanting to be doulas. How can they be doulas? We have already been doing trainings for, oh my God, over 20 years, but we will be starting doula trainings that key into the Medi-Cal portion, what is required, the twofold way of being able to function as a Medi-Cal doula. Very, very important for folks to know that that special brand that California has, that we have a twofold way of serving Medi-Cal patients. So we want to make sure that's really well known. It's not well known, even though we've been talking about it, and I can hear from my other doula siblings how much they're talking about it and sharing within their communities. So we want to keep that going and actually inspire other doula hubs, other groups that are willing to speak to their communities about the importance of the service for them, the benefit to them, and being able to sign up and begin to participate. My concern is around a slight emotional shift that I see in some people who are showing up requiring about doula work. There is because we live in trying times, I do understand, I'm not blaming anyone, but there's so much of a focus on the money aspect of it. And there's a reason for it for some people, for sure, because some doulas are not getting paid. Some doulas are going through the process, following the rules, and they're not getting paid. So that causes distress. I'm wanting to have us talk a bit more about the calling. Like, why do you want to be a doula? Is that for you? Because it's very important to maintain the good statistics that we have, that folks who are called to this work and want to do this work are allowed to do this work. The system doesn't give them any barriers to keep them from doing this work. So we have our monthly gatherings where we get together and talk about how to sign in on PAVE and what that's about. We talk about how we sign up with the various insurance carriers. And that's really where most of our problems sit. Alameda Alliance is wonderful and helpful. But our friends at Kaiser, we really need to have that straighten up and really have that be something that's more doula friendly, family friendly. So we would have more doulas be able to show up for this. So we have more doulas know that this is a system that is inviting to them, but also not wanting to change how doulas operate with clients, how doulas negotiate with clients, what information that doulas are given, that should come from the trained doula or experienced doula to her client, rather than hospital policies. Hospitals certainly can inform us of what their policies are, and then the doula helps the client to weed through that and to decide what their family wants and what works for them, because the doula is the mom and her family are the final say in what happens in the birth room, barring any kind of an emergency situation. So I am going to hope that we continue to work on this and focus on this, and that complaints are taken really seriously, as they have been. They continue to be taken seriously, and we continue to work together to build a system that works for the whole of the community. Medical people, works for doulas, works more specifically for birthing people and their families. So thank you so much.
Thank you all to the doulas who presented today and all of the information that you shared. Really appreciate that. We are now going to move into our Medi-Cal Managed Care Plan presentation. Let's go to the next slide. And we'll be starting with Kaiser Permanente.
Good morning. Closer. Okay. Can you hear me now?
Yes.
Okay. Good morning. Hello. Thank you for inviting Kaiser Permanente to speak today. And Sam Sarah, always glad to be in partnership with you on a panel or in a presentation, and look forward to our partnership. My name is Crystal Haswell, and I'm a Medi-Cal policy consultant who's been working on the doula benefit from the very beginning, both at Kaiser and in my previous role at the California Healthcare Foundation. Shout out to my friend Amelia Cobb and the Doula Core Work Group, and DHCS, of course. My main role at Kaiser focuses on policy analysis and advocacy, but I also collaborate with a dedicated team that works to ensure that Kaiser is implementing the doula benefit in a way that's impactful to our members, to our clinical teams, and doulas, while also advancing our broader commitment to maternal health equity. Today, I'd like to briefly share what we're seeing so far, what we've learned through implementation, and how we're continuing to strengthen partnerships with doulas across California. Next slide. To give you a quick roadmap, I'll start with the impact that we're seeing on our members, then share a few lessons we've learned through implementation. I'll also highlight our efforts around doula training, community partnership building, member awareness, and the resources we've developed to support doulas. With that, let's start with member experience. The feedback we're hearing from members reinforces the value doulas bring to the pregnancy and postpartum experience. Members consistently describe feeling more prepared, more supported, and more confident throughout their birth journey. One member compared preparing for birth with a doula to training for a marathon, emphasizing how important that preparation and support was. Another described the benefit as so valuable that they actively encourage others to use it. For us, these stories are an important reminder that doulas are not just another benefit. They're trusted care partners, and they can significantly enhance the member experience and play an important role in advancing more equitable, culturally responsive maternity care. Next slide. As we've implemented the benefit, we've learned that success requires both operational infrastructure and strong partnerships. Some of the steps we've taken include increasing our presence at community events, creating a dedicated email address for doulas, and clarifying hospital visitor policies so doulas are recognized as part of the care team. We've also developed welcome letters for doulas for our medical centers, shared safety guidelines, trained our staff on the role of doulas, and encouraged the use of our online affiliate portal to simplify the administrative processes. One important lesson we've learned is that listening, ongoing communication, and education help build trust and make it easier for doulas to integrate with our care teams. Next slide. A key part of that effort has been our doula training webinars. These sessions are open to all doulas, regardless of contracting status, and focus on practical topics like contracting, claim submission, billing, and navigating our RKP processes. In 2025, more than 650 people attended our webinars. We've continued that work this year with strong participation and additional sessions planned through the end of the year. Our goal is to provide doulas with clear information and resources that support successful participation in the benefit, strengthen the doula workforce, and ultimately expand access to supportive, culturally responsive care for our members. Next slide. We recognize that successful implementation depends on authentic relationships with doulas and birth equity organizations throughout the state. We see these partnerships as particularly important to our maternal health equity efforts because doulas and community-based birth organizations bring insights that help us better understand and respond to the needs of the communities that we serve. We've been participating in local events, community gatherings, and stakeholders discussions to better understand community needs and strengthen partnerships. Internally, our doula birth equity tiger team brings together experts from across Kaiser to support implementation, problem solving, and continuous improvement. These relationships help ensure we're not only administering a benefit, but also partnering meaningfully with the communities we serve. Next slide. Another area that we focus on is member awareness. A benefit can only have impact if members know it exists and understand how to access it. We've enhanced our doula directories, updated information on kp.org, and created educational materials to help our members connect with available doula services. At the same time, we're educating our physicians, midwives, and staff through a doula micro-training series so they can better support conversations about care and help connect members with available resources. Next slide. As we continue to refine and expand our work, we encourage doulas to stay connected through our community provider portal. The portal contains updated information, training materials, webinar announcements, and other resources related to the doula benefit. We also maintain a dedicated doula liaison email address and member services support to help address questions and concerns. We view this as an ongoing partnership and welcome continued feedback from doulas, providers, and community organizations. Next slide. Thank you again for the opportunity to share Kaiser's experience implementing the doula benefit. We're encouraged by the positive impact we're seeing for our members, and we're committed to continuing to learn, strengthen partnerships, and expand access to doula care and continue advancing maternal health equity across California. I appreciate your time today, and I look forward to our continuing partnerships.
So much, Kaiser, for presenting that. We are now going to transition to Central California Alliance for Health. We can, next slide.
Hi, my name is Jessie Dibdahl. I'm the Provider Services Director at the Central California Alliance for Health. Today, I'm going to tell you about our doula benefit implementation and some barriers we encountered, as well as the doulas themselves. I'm going to talk about our grant program implementation, our current network status, and also the doula benefit utilization, and then some lessons learned we learned from implementing the benefit itself. Next slide, please. All right, so January 1st, 2023 is when the benefit went live, and jumping into this with the network development team at our health plan, we identified some new barriers that we'd not experienced before. We found that independent doulas often faced really challenging contracting, credentialing, and administrative barriers. We know the system wasn't set up to support them, and so we spent our first few months kind of doing the normal status quo, but we found that that was not the right approach for this network, and we also found that we needed to spend time with our doula network and build that trust to make sure that they knew working with us would be something that would be to the members' benefit and their benefit. Some of the managed care processes, including the alliance, were really arduous and challenging, and there was just an inability to move forward quickly in the manner that would best support both the doula network as well as members. And so internally, we sort of took a pause after the first few months to figure out what can we do to shift and implement our organization to better support the doula network that ultimately will support our membership. And so we came up with two ideas for grants that we thought would be really valuable. One is a grant for doulas themselves, providing funding for them for an estimated full year, which would allow them the time that they would need in order to enroll and pay and get their NPI and all of their other requirements through contracts and credentialing. And then they begin learning how to bill the alliance and bill for services. And so that foundational initial support would give them the necessary funding they need to be able to take on some of that work. We also developed another grant that allowed us the opportunity to, oh, sorry, would you go to the next slide? This identifies more specifics about our grants, but we had a technical assistant grant, and this grant went to local community-based organizations to help support doulas. So it gave an opportunity for local doulas to work with community-based organizations they felt comfortable and confident with, and provided the opportunity to go to them to learn how to get the NPI and enroll in Medi-Cal versus having to work with us, who certainly we want to be a partner, but it might feel intimidating or challenging to work with because they've not worked with a health plan before. And so we started distributing some of these grants in March of 2024. It did take us quite a few months of 2023 to build out this grant program, but the first distribution was in March of 2024. And we were able to, over the course of a few years, distribute 31 grants totaling $1.9 million to help subsidize the first year of expenses for doulas. And out of those grants, 30% of them were to bilingual doulas. We also did 8 grants to the local CBOs that provided technical support. And a part of that, there were 2 doula administrative hubs providing both doula and CHW services. There was also a referral hub for doulas, for solo doulas, to help support their referrals. And then also just connected members to doula services within the community. Next slide, please. And so what we found is that by implementing this grant program, we were able to build a really strong network of doulas. So we're a health plan of 5 counties, and we have over 100 contracted doulas within our 5 counties. We also developed some specialized training and onboarding specific to doula providers in conjunction with the CBOs that received the technical assistance grants. We also meet with our hospitals, every hospital within our counties, on a quarterly basis. And as a component of those meetings was to talk about what their rules are for having doulas in the hospital and make sure they're aware of the doula benefit and that it would be a requirement from the health plan to ensure that doulas were allowed in the hospitals. And if there were any barriers with those hospitals, we talked to them about how we could help support and remove those barriers. And every doula at our health plan also has a dedicated person who's local to the county in which they support. And it's their personal email address, their personal phone number, and they're there to help support in case issues arise. Next slide, please. So you'll see here our doula utilization over the years. Obviously in 2023, we really struggled. As I mentioned earlier, we had to pause and figure out the best way to help support the doula network. In 2024, as we started with the grants being distributed in March, and it did take a while for claims to start coming in because we understand it's a new process and challenging, and it took us a while to be able to support doulas in the manner that would help support everyone. And so in 2025, we feel like we started to really get our stride with our membership and our doula network. And in 2026, you'll see we're continuing to see an increase in services. And these are just 2026 is just until June. And so that's just half of the year so far. And then I included the dates of the doula grant program at the bottom as well. Next slide. So just some of the lessons we learned in implementing this benefit is that non-traditional providers, both doulas and community health workers, and for us, it's ECM providers and community sports providers, they definitely benefit from a different onboarding. They don't have the staff and resources to help support them with contracting and credentialing, and so we needed to figure out how to help support them. Also having financial incentives like the grant program definitely increased doula engagement and support and network participation. And then for us, we found that having local CBOs and local doulas was the best fit for our membership. And so we definitely learned that through this process as well. Okay, I think that's the last of my slide. Yeah, thank you.
Much to Central California Alliance for Health. Now we'll be transitioning over to Cal Optima Health.
Great, thank you. Good morning, everyone. My name is Ann Mino, and I'm the Senior Manager of Maternal Health at Cal Optima Health, which serves Orange County. Next slide. So over the past few years, we've integrated the doula support into our maternal health program in a really intentional way. That includes training our internal team, which outreaches telephonically to our pregnant or our postpartum members on connecting them to doula services, including really educating them on what the doula services will provide. Building partnerships with doulas. So in the early days, we did a lot of doula trainings, meet and greets, and also working collaboratively with our community-based organizations, because we know that our members are receiving services there. And so we want to make sure that they're able to let them know about the benefits that they can receive through Cal Optima as well. And also doing provider education with our contracted providers. So this collaboration has helped increase the awareness of the benefit so that members do know about the doula support across multiple points in their maternal care journey. And as you can see here, we have had our utilization growing every year, and we are on track to at least meet 2025, if not go beyond that. Next slide. So we've had several key successes during implementation, including strong cross-departmental collaboration, really increasing the awareness. So making sure that everything's on our webpage. We've created flyers. We've done just education to our providers through newsletters, and also really having active doula participation in our community events. So we invite the doulas to come out, especially when it's meeting this population. We have an event that we have a handful of doulas coming out to meet our members in the community that they maybe haven't worked with. And so letting the members learn and be educated on these services. So in about a month, we'll be having about 4 to 5 of our doulas come out and support that community event. But we've also had challenges throughout the years. So things like onboarding, which we know can be lengthy, contracting with multiple health networks. But we think each of these challenges has really helped us, and it continues to help us refine workflows and strengthen the overall benefit. So it's been a learning process for all of us. And this leads directly into one of the most important things that we learn that I want to talk about today, and that's how our members are experiencing the doula support. So next slide, please. So we have been doing annual member satisfaction surveys to make sure that we are meeting our members' needs through the doula support. So it's something that we prioritize because it tells us how the doulas are meeting the members' needs and also the barriers that the members are seeing to receiving these doula services, and where we have opportunities as an MCP to grow and how we can better support our members and our doulas. So we do conduct this each year. We're actually in process right now of doing it as well, and we do it telephonically. So we're outreaching to our members, and from the ones that we've done, we've successfully contacted about 40% of members that have received doula services during our review timeframe. So we're looking back a year when we're doing it. During those surveys, so that was 2 completed, we're on our 3rd annual right now, is that 89% of the members that we reached rated their doula experience as satisfactory, good, or excellent. But it's the comments that really bring this to life. So we're hearing things like, as a first-time mom, this was a big help and I felt supported. Or, it's my 5th pregnancy, but it's the first time I've had a doula, and the extra support made a big difference, especially for my mental health. So this tells us that doulas are filling important gaps as part of the members' care team, offering emotional, physical, and informational support that the members truly value and truly need. Next slide. So as we look ahead, our focus is really to continue expanding our doula network, increasing our member awareness, making sure that as we are outreaching to the members, they're aware, but it's also on our website, there's flyers provided so that our members can know from a variety of avenues, and streamlining referrals so members and doulas can become more easily connected. So we've seen that as something that we could do better, is making sure that our members and our doulas can connect easier. And so we're working on that. We're also working closely with our provider relations team, updating our member education materials, because right now it's really how to get a doula, but updating so there's more education. They know what those services are going to include, participating in those community events, and also continuously monitoring our utilization and our outcomes to really help us and guide us to continuing improving this benefit. So thank you so much, and I'll pass it to the next speaker.
Thank you very much, CalOptima Health. We really appreciate that presentation. Now we'll be moving on to our spotlight stories. And our first one up will be Kairis, apologize.
Hi, and thank you. Can you hear me? Yes, no?
Yes, we can hear you.
Okay, thank you. Well, good morning. I am a full spectrum doula serving California's Medi-Cal families, primarily Black and Brown and marginalized communities who have historically experienced some of the poorest maternal infant health and outcomes for our state. I have the privilege of being as Sayeda mentioned, the provider for the Northern California, the Sacramento region Blue Shield of California pilot prior to the benefit being written, and I founded a tiny organization called Children of the Sun Doula Project, which is an affiliate of the original Birthing Project USA, Black maternal health organization way back in the 80s. And so when you look at how this work continues to prosper and move forward, Her Health First is actually the current iteration of Birthing Project in the Sacramento region, these some 40 years later. I also get to work with birth workers of color in the IMI Doula Learning and Action Project that is happening, that we're entering year 3 of there. And Children of the Sun is also the home of Queens Village, which is the organization that says, yes, we can respond to emergencies of birth outcomes, but we could also front load the stress release and the celebration of Black birthing bodies through providing events in that space. If my math is correct, when I add my 27 years of continuous practice birth work, the doulas on the co-design and implementation team have about 160 years of experience. That's a lot of births. And so I just want to also thank our families and partners and communities who have supported us and held home down while we were out supporting California's families. Every birth that I attend reminds me of one truth, and that is that birth is not simply a medical event. It is a family event, an economic event, and a community event. If you could go on the next slide. I want to make sure I'm where we are. Okay, cool. California made an extraordinary commitment by covering doula services through Medi-Cal, and it recognized that what research has consistently shown that people supported by doulas are more likely to experience lower cesarean birth rates, fewer medical interventions, shorter labors, higher breastfeeding initiation, greater satisfaction with their birth experience, and lower rates of postpartum depression. For Black mothers especially, these outcomes matter. Black birthing people continue to experience maternal mortality and severe maternal morbidity rates at multiple times higher than their white counterparts. Black infants also experience significantly higher infant mortality rates, and doula care has become one important strategy for helping those with close these unacceptable gaps. But healthy births are only the beginning. Next slide, please. Every confident parent creates healthier children. As much as our medical advances work hard to save lives, there are some things that cannot come through technology, and that is where doulas come in, particularly private practice doulas. We leverage relationship as healthcare, and it holds the door open wide for families to become the leads in their own care. Every supported birth creates stronger families. Every educated family becomes an advocate for someone else. Knowledge spreads through communities. When one grandmother learns what informed consent looks like, when one father understands newborn care, when one mother learns her rights, lives are saved. That education doesn't stop with one birth. It becomes community knowledge, and doula care is also workforce development. Many of us are members of the very communities we serve. We create businesses, we pay taxes, we hire staff, we mentor future doulas, we circulate dollars back into neighborhoods that have been historically underserved. In other words, healthy birth creates healthier local economies. Health plans benefit too. Lower intervention rates, fewer complications, lower NICU admissions, reduced postpartum crises, earlier family stabilization, and these are not only better outcomes, they're lower costs. Next slide. Despite California's investment, many doulas are struggling to stay in business. We spend weeks or months waiting for credentialing, in some cases years. Applications disappear, phone calls go unanswered, billing systems fail, claims remain unpaid. Entire episodes of care go uncompensated. Some doulas leave the field, not because families don't need them, but because they simply cannot afford to continue to work for free. And I know this is a new provider type, not just for California residents, but for the healthcare companies. Recently, I was asked to submit records and notes for a birthing person for audit, and it wasn't someone I had even served. Fortunately, I was able to point out that the NPI numbers didn't match. I didn't know this client, and I had never submitted any billing. That said, I want to thank the companies that simplified enrollment and provide dedicated staff who have been helpful during these processes. One healthcare company hosts a monthly call for questions and education. I mentioned a rejection of claims with no errors for a high-risk client over a 6-month period. A leader on that call got personally involved and solved the problem. The claims were paid, and my bank account will be forever grateful. It was a slow process for us after training thousands of doulas between us to get them through the PAVE portal, which we have now mastered. The bigger challenges are with the contracting with the individual MCOs and MCPs. Just as we started to get the ball rolling, we ran into another problem. Now we're hearing another troubling phrase, network adequacy. On paper, plans may claim enough doula. In reality, families wait months or don't receive care at all. Asking skilled members of society to work for free points back to a history we worked really hard to get away from. And while some doulas make the sacrifice because of the needs of their community, the idea of asking them to do that is abhorrent. There are other data-informed challenges. Large geographic areas have few or no available doulas. Communities requesting culturally responsive care cannot find providers. Adequacy on paper is not access in practice. And when we look at the numbers of birthing people in California, adequacy doesn't even exist on paper. As a private practice doula and doula trainer, having our presence questioned, being treated as a visitor rather than a member of the insurance authorized care team, or other delays in care caused by hospital entry processes can leave clients isolated. Not being listened to when clients are experiencing challenges can delay patient care in urgent situations. With over 80% of Black deaths alone being preventable, we know trusted care providers are essential, and it is heartbreaking when we are separated from our clients in birth settings who think we are an inconvenience or worse, a visitor. During business hours, we might be able to call a Mama Linda or a Mama Sincera or a hospital administrator ally or an OB friend. But in the night, when babies come, witnessing coercion and managing the tension between being threatened with not being allowed to support and the fear in a mama's face when her birth preferences are being ignored, means the day of their birth becomes the child's first adverse childhood experience. It's simply not acceptable. While some clients have been discouraged from using their benefit with a hospital volunteer doula that might be available during their labor, perhaps, I do want to shout out the amazing nurses and OBs and midwives who welcome us and help build amazing care teams for a client-centered birth. I personally want to thank you. On my last slide, California has already built something extraordinary. We spent years doulaing this benefit from conception to its January 2023 delivery, and we are currently in the postpartum benefit birth era. Now we simply need to remove the barriers preventing it from working. And it is critical that we not forget the private practice doulas who aren't employed by CBOs, who are carrying communities literally on their backs by themselves without the same infrastructure as the organizations. Healthy births, healthy families, healthy communities, and yes, even cuter babies, although that may be my own bias. Where we all agree is every baby deserves to begin life surrounded by support, dignity, and joy in utero, at bedside, in community, in healthcare, and in policy. Thank you.
For that. Before we move on to our next story, I just want to share, I know we're over time, but we are going to continue with the 2 next spotlight stories, and then we're going to have at least 10 minutes for Q&A, and anything that we're not able to answer, we will be taking back. So we encourage everyone to continue to stay on. Next up is going to be Andrea.
Hello, good morning, everyone. Pardon me. Thank you for having me here. I do understand that we're over time, so I will keep it concise. But just thinking back to, almost 8 years ago when I myself was pregnant for the first time, and a lot of times I think about what doula support could have really done for me in that experience. I could not afford a doula at that time. And so when this benefit went live, like immediately, I knew like this is something that was going to be historical, that was going to change a lot of lives. And um, going into it, I was like, okay, not really knowing what it would look like to, be approved in the whole process. But within that first 2 years of the benefit, I supported over 70 families in some capacity. And that was mostly because folks were not signing up. They were scared. We weren't getting paid. They didn't know there was no clear understanding of what the requirements were. And luckily enough, I was very close with I'm a collective member of First Workers of Color Collective at the time, just a collective member. And so I got that support. I was in connection with other community orgs like Frontline Doulas, that really held my hand and supported me through the process. And so when it came time for me to step up and take on that role of supporting doulas, I had a lot more understanding of what it was like to be in the field doing this very deep heart work, but not getting paid because of, a lot of red tape and bureaucracy that we hadn't anticipated. Um, Now I feel like things are a little more smooth, but there are still a lot of hiccups. And, as the Medicaid manager of First Workers of Color Collective, I feel really um, blessed that I work with an org that, is thinking of doulas. And, we secure funding so that when we don't get our claims right away, we can pay our doulas out. But most doulas do not have that privilege, or they don't have that opportunity. And so they're just kind of trying to figure it out on their own and hoping that they get paid within the amount of time that they're supposed to. And I just think like there's no other provider that accepts Medi-Cal where they would work for free for that long, hoping to get paid. There's no guarantee that they will, nor would that be allowed to continue 3 years going on 4 into a benefit. And so I do understand that there are processes and there are things that, needs to change, but it has to move a lot quicker than this. It's not acceptable for this to continue where folks are just uncertain that they're going to get paid. And I feel like that does contribute a lot to these lower utilization, lower, folks signing up. And we can see the increase over the years, but it is still not enough. California has some of the most, the highest numbers of birthing people. And so the number of doulas that are contracted and actively supporting folks is not nearly enough. And I host some of the paid trainings to support doulas through the process to become approved. And a lot of times they come to me and they're like, hey, I have a prospective client that's due in like, maybe a month out. Do you think I'll be able to get to through this process? And I have to be very honest with them. And I have to say, probably not. You could get approved for pay through that time, but what managed care plan does this person work with? You have to also go through the process of getting credentialed with them. And that's where a lot of the hangup is, because depending on which managed care plan, it might take a while to hear back. The contracts are very long. So there's a lot of barriers that are stopping folks from supporting families. And if this family has already connected with that person, they might not want to work with another doula or figure out who else is available. And if they've made the contact with this person, they should be able to work with them. I know there's been talk of LOAs. In my experience, they have not been paid out consistently. There are a lot of plans that still owe the org and myself a lot of money through these LOAs that have not been paid out. Either they're not honoring them outright or they're not paying at the TRI rates when they previously stated that they would. I understand there's documentation out now that states that they don't have to, but prior to that, that was the expectation. And so there's just a lot of like little things that are really keeping folks from um, supporting communities. That's what this benefit is all about. And just, I know there are other states where the process is a lot simpler. And I know that California is bigger and it's different, but I do believe there is a way that we can simplify this process for doulas, and just make it so much more accessible so that the folks that are ready to get out there and support the communities are able to do so, without fear of not getting paid, or how long is this process going to take, or just these things that are really huge barriers to what this benefit is supposed to be doing. And it's such a beautiful thing. The families that I have supported, it just warms my heart to be able to do so and know that, they're not worried about how am I going to pay this doula. They can just focus on the other millions of things that they probably have to pay for and still get the support that they need. And so when it works, but there's just so many things that, we need to fix. And I think just having these continued conversations where the institutions are listening to the individual doulas and listening to the community-based boards, we can get a lot of these things done so that this benefit is more of a well-oiled machine that it could be. Thank you.
I really appreciate that. We're going to move on to Chantel.
Good morning. I just want to acknowledge the doulas that came today in person. I just want to give you a round of applause because it really means a lot for us to come together and take time out of our day to rally around this benefit, because I know each of you in the room today and online represent hundreds of families that have trusted you, community partners that you've worked with over the years, and you've held space for some of the most important events in someone's life. And so thank you for taking the time to come today. So I'm Chantel. I am a mother of 4 and also a recipient of Medi-Cal. And as a doula for over almost 18 years, I've walked with families in hospitals, in birth centers, and at homes as they navigate their birth and reproductive journey. As the founder of the Sean Collective and a leader at Sankofa, I also developed a program called the Doula Lab, which is a peer support, workforce, and professional development space for Medi-Cal doulas. And, as I, like a lot of my colleagues, were some of the first doulas to try to enroll in PAVE and become a Medi-Cal provider, I'm acutely aware that coverage does not equal access. And so we've seen the evolution and we've seen the growing pains that we faced during this implementation period. And today, I'm just going to highlight a few of the stories over the past, 3 to 4 years that shows, some of the things that are working really well and other places where there's room for growth. I'd like to think of it almost like a recipe. Asking, does the benefit work, is like asking if a recipe works. Like it only works if you work it, right? And what I've seen, just like in baking, I'm a terrible baker, and so I know this really well. My sister's a great baker. Each ingredient needs to be present in the right proportion, entered at the right time, handled and interacting with the other ingredients in the right way for us to have an outstanding French dessert, because their desserts are the most complicated, right? But we know that in baking, let's say a macaron, right? A single mistake can ruin hours of work. In the case of birthing families, the risks are much greater. For the doula benefit to work, I've calculated that it requires the cooperation and collaboration of at least 12 different checkpoints, personnel, or parties. And that is no small feat. I'm a mom of 4. Trying to get everybody out the door on time is not very successful. So where have I seen it work? And a triplet mom postpartum who needed somebody to rally around real quick and was able to connect 3 to 4 other doulas to support her and her growing family. With a single teen birthing person who wanted to have a different life for themselves and had aged out of foster care And they, because of this benefit, was able to have somebody who was compensated to spend the night at them with the hospital after delivery, visit with them at home several times to make sure that they were well equipped to be successful with managing their mental health and having access to lactation support. And what about some things that aren't working so well? We have some barriers to care where this person planned, had their doula ahead of time. We talked to the anesthesiologist, the OB, but unfortunately it was a birthing, the nurse supervisor and an interim director who asked me, does, this health plan, Kaiser, actually pay doulas to provide doula support? This is in 2026. We also see that a place of growth and challenge. Doulas are entering this meaningful work and being compensated. They're able to start their own businesses. Meaningful work and belonging is key to a community thriving. And for us to be able to do this and see that in small but in significant ways, we're making a difference in our community, that's really, really important work. So I think right now we're at a place where we have an invitation to examine the recipe. What's working well? What isn't working well? What do we do next? It's clear that doulas need support with technical assistance, workforce development, and being able to have the runway to do the work without having to worry about, am I going to get paid this year? Okay. Families need access fast. Okay. We know that babies don't wait for LOAs or approvals, and neither do emergency reproductive procedures. Okay. Let's keep working together to build better birth stories. And for those of you who are interested, I'm going to drop access to the Doula Lab in the chat so that wherever you are, you can join in via webinar, in person. We can continue to support each other. We can continue to advocate and do, to help implement this policy and hopefully build better families and cakes. All right. Thank you.
Thank you, Chantel. I really like the bakery analogy. That was great. So we've gone through all of our spotlight stories, and now we are at the Q&A portion. The team has done a really good job of answering the questions as they come in. So I do want to start with the audience. Does anyone in the audience have any questions for any of the presenters or anything that they'd like to ask? Okay, we're going to bring the microphone to you right now.
On. Okay, so thank you all for convening this today. It's really just been so informative. Just to keep it short, the question I have pretty much, it's just one of the areas kind of like from the recipe model that was just shared, which I think is fascinating. I love that. I'll use that. So this is a question for DHCS, and I had to write it down. I want to get some clarification on how DHCS thinks about appropriate utilization of the doula benefit. So, I know on the website in particular, it's named the variation across the plans. For instance, partnership is about 7.7 doulas per users or per 1,000. IHP 6, LA Care is 1.5. Cal Optima, I think, was under 1, and Central California Alliance is 0.7. So, thinking about that from DHCS level, when you see that kind of variation, how does DHCS interpret what's driving it? How do you distinguish member demand from issues like network capacity, referral pathways, outreach, or other implementation barriers? And are you considering any benchmarks, near term or long term, or guidance for what appropriate utilization should look like across plans for this benefit?
Hi, this is Erica from DHCS. So I can take a stab at this. There's a whole bunch baked into that question. So I'm going to start with a general statement. I don't know that I could tell you with absolute certainty what the perfect number of enrolled doulas would be, what the perfect amount of utilization would be. But for me, the perfect future state is every single Medi-Cal member who wants a doula during their birthing journey has access to a doula of their choice without barrier. So for me, births ebbs and flow, but that could be a really big number. It could be a really small number. But for me, it's no member raising their hand and saying, I couldn't get the doula that I wanted for my birth experience. And so I think that's what success kind of looks like. And it's a really hard thing to measure. We often talk about things in how much utilization are we seeing? How many claims? How many managed care encounters? We talked about the enrollment figures today. We talked about, PAVE enrollment and then managed care contracts. And so there's a lot of data out there. But I think at the end of the day, for us, all of the work that we're doing is really, it's twofold. One, it's to meet the needs of our doula providers who have raised very legitimate concerns to us about access to care and barriers in an environment that was inherently made for medical providers, clinical providers, and so there was a learning curve. And so we are still working through that. But I think that the first piece is making sure that we're meeting the needs and being responsive to the concerns raised by our doula providers and working through those. And then the second piece, again, is really that member-focused aspect of ensuring that, again, any member who wants a doula is able to access a doula. And so for me, that's kind of what success looks like. And I didn't completely answer your question about benchmarks, but I think right now we're just trying to get to the point where we aren't hearing stories about doulas not being able to accompany their clients into hospitals, doulas not being able to contract with health plans, members not being able to access doulas of their choice. I think those are the things that we're really trying to get at kind of acutely. And then we're going to think about longer term strategies, I think, going forward for how we want to continue to monitor it from a more data-driven perspective. And I don't know if anyone else wants to add, sorry.
I think that was great. We do have another question from the audience.
Hi, my name is Rajni with Public Works Alliance. I have a question for maybe some of the community-based doula organizations or plans or even DHCS in the room. While the benefit has been a historic win, I think we've heard today that Medi-Cal will never fully cover the cost of what it takes for community-based doula organizations or hubs to be able to provide the kind of community support needed to engage doulas, keep them on the benefit, navigate all of the different challenges that are out there. We heard some great examples of grant programs that plans have put out there. I know DHCS has invested significantly in this benefit. Going forward, what kinds of permanent or more sustainable funding streams should be available to support the ongoing capitalization of community-based doula organizations in an ideal state? And what would it take to actually get there?
That's such a great question. I'll give some examples to answer that. So what it could look like. What we've seen, there's a lot of diverse ways that it's happened, but something that seems sustainable, Alameda County is a good example. They have sponsored HIPAA training and CPR for the community and allowed their space to be available to the community-based organizations to train doulas and to convene to support with the practical things, the doula lab, for instance, where they are open up your computer. How do you do the MPI? Let's get on the PAVE application. Oh, you didn't understand what this question meant, right? So there are spaces in our existing ecosystems in every single county where there are buildings that are covered by the government that are available. And if you can open up your doors and let people know that your spaces could be available, and also there's compatibility with that funding. So in some places where we've had people do CPR training, I mean, our organization, my nonprofit, we funded a CPR training for any of the doulas that were in the area who might have missed some of the things at my home, right? Because I could do that for our local community. But there are other people who need CPR training, right? So maybe the counties or organizations, even the managed care plans, I'm sure lots of people need CPR at a regular basis. Is that something that they could cover? And then it's not just this special thing just for the doulas. It's something that's sustainable that any community-based person, the child care providers that need CPR, parents, my daughter who's a teenager who wants to babysit also wanted to have infant CPR, right? So I think that there's ways to think about what doulas need. They need to get an MPI number. People need support with the application process. They need practical support with computer stuff, with technology, right? So a lot of us have gotten organizations to help fund laptops and tablets so we could take it to where the doulas are and show them. Who does that? Is there a community-based organization that already has computers that could say, hey, use my space? Several of our organizations, Sankofa, Diversity Uplifts, Frontline, a lot of the other organizations, BWBJ, have gotten funding for the cost of insurance. the insurance is, $160 to $300 depending on the doula. In order for them to have insurance, that first year you have to do a business license. That also costs hundreds of dollars. Where do you get a business license? So where are the small business association people out there? Doulas need business licenses. They never needed that. This is a brand new thing because of this benefit. There are lots of people who already sit in the ecosystem who just aren't like called in, but also can jump in. So that's just sort of like logistically some of the things. But in our minds, it could be, where is the money flowing? It seems that the managed care plans are given money, community funding to support community things. This is a new benefit. There is funds that are given to the managed care plans to support. But I don't know. I mean, of course, how would you know what you need when a new benefit comes on? The woman talked about them realizing over the years. I think Kaiser also, so many of our partners have realized, oh, doulas need this. We need to create a person to do this, right? So just keep the loops connected. Let's keep working together. And the people who have money, put it toward these things. And if you're wondering, because you're like, oh, I have money, where should I put it? There are community-based organizations who have the doulas today. We train them today. There are lots of places where they're already coming and we don't have money to do it. So we may be doing it, right? So I think, go to the community-based org. Community-based orgs are aware of what are the larger systems that are around them that can take the doulas to the next level that they can't have. And just, let's keep being a communication across our systems. Yeah.
I would also like to add that those community investment dollars that the managed care plans are asked to reinvest into the community be distributed very seriously to the community organizations who are trusted and who prove that they do the work and deliver. That's really important. Also, we have to remember that there's other types of investment that can be made in community, from brand sponsorship, where corporations reinvest into the communities that buy their products. There's business alliances. There's other types of investment and investors and new ways of looking at this as a commerce and a new economy rather than just old traditional ways and methods of funding. So I think that we need to be unique and innovative in the ways that we fund them. Also needs to be sustainable. It needs to go to the capacity and infrastructure of these organizations over time. It feels extractive. If you fund somebody for 1 year, you get all the results. We'd create a whole benefit. We devise all the evidence-based practices, deliver, and then the funding stops, of which everybody here on this panel has experienced. Yet we have created this beautiful culture that is contributing to lowering the costs and directly influencing the results of maternal and infant care. That deserves investment across the board from multiple sectors, not just one sector. And I think once those sectors understand how that influences the community and the benefit to those who actually are economic principles, the workers, the real caregivers, the people who have to get up and go to work to take care of their babies, get them to the school district, get them to the child care officer. All this stuff requires cross-sector investment. So I think there needs to be some creativity, and we take this across the board to other industries, not just the healthcare industry.
Caffrey.
I would also I'd like to just hop in there and say that you have to understand that the doulas that are stepping up and wanting to do this are coming from this community themselves, and they're not independently wealthy. And to ask them to, as Kyra said earlier, for free is not good. And so a lot of us orgs are trying to step in and pick up the slack if the managed care plans are not paying for them. It has to be done. We have to either get the managed care plans to act right and pay them on time, because you can't do this work and still feed your family and pay rent if you're not getting paid. That's not fair. You're asking someone, we're supposed to be the answer to this problem. We're supposed to be the answer to the maternal mortality problem. You can't tell somebody to be the answer to it and then not compensate them. And so we need to have funding for the orgs that are trying to hold these people until they get paid the correct way. And we can't do that if we don't have the funding to do it.
For that addition. So we're going to take one more question from the audience, and then the other Q&As that were put in the chat, we will be making them available with our answers on the DHCS Doula webpage. So I'm going to go ahead and pass it over to our audience member.
So this is a two-part question from the trenches. Is there hope for us to be paid for no shows and to be paid for remote support through text message and voice messages, because a lot of the clients that we support are no English speakers or disabled people who cannot get on a phone call while they're giving birth. So this is something that I ask at every chance I get, and I want to leave that noise in the background for people to think about this. My community is suffering because we have to talk through, a lot of doctors put this barrier that they won't talk to me in English and to my client in their language. They don't accept me as a translator. They want to talk to a translator, but then they don't allow my client to make a video call because it's not HIPAA compliant. So they keep putting these barriers. I had a client delivered this week through a C-section she didn't want because she went for a non-stress test that they didn't allow her to call me. She kept sending me voice messages, recording what the doctor was saying, and I sent voice messages back to her. Again, I was not paid for this 2 days of services that we went back and forth this way. And she ended up with a C-section because the doctor wouldn't allow her to do a video call with me while they were discussing everything. So being paid for alternative support for people with disabilities and not English speakers, and for no shows, because a lot of these people end up going into the surgery and they don't have a chance to tell me, hey, I'm going into surgery. Can you please come and help me after I deliver? They don't even know it's an option for the doula to be there during recovery if they get a C-section. And we end up not being paid and not showing to support them because the people who are there, who are supposed to tell them, yes, call your doula, are telling them, oh, you don't need a doula, you're getting a C-section.
Yeah. Can I respond to that quickly? Dear doula, thank you for your work. This sounds like there's a lot that DHCS need to respond to, as that provider needs to respond to get that into compliance, and that there should be very strict protocols put into place so that never happens again. But it seems like there was a lot of issues there that are truly out in, need to be put into compliance and punitive measures. So I hope that we can connect you to the DHCS reps here on this call to ensure that the clinical provider and your client are brought to justice. Thank you for sharing that.
Great. The barrier that you're emphasizing of not having access to the member to provide the service, like that is what we've been talking with our doula partners here, and what we're trying to address with like the best practices and the other policy updates, because that's not what we want to occur. We want the member to have the doula and be able to provide the care, be part of that team. And so hearing that story is kind of what we alluded to, like that's what we don't want to keep having to happen in the community. As far as okay, I'll pass it to Erica about the telework services.
Yeah.
Telehealth, sorry.
So there's two parts, right? So this group of doulas we've worked with for so long knows that I'm completely transparent when it comes to how policies work. So I do just want to be transparent that under current Medi-Cal policy as it stands today, there is not an ability for us to reimburse for services that aren't provided to members, which would be the no-show concept. It's not a problem unique to Doula Services. Many of our other providers have similarly kind of made requests because, when people don't show up, you've allotted the time, now you're not doing something else. And so it's definitely an issue that is on our radar that we're kind of thinking through more holistically about what we can maybe do creatively in that space. But at this time, I just want to be transparent that it's not something we can technically pay for under the policy. On the telehealth side, so one of the things that's kind of great about our telehealth policy in Medi-Cal is that it's intended to be a flexible, and it puts the power back in the hands of the provider who is providing the services. And so doula services, like every other Medi-Cal service, are able to be provided through our allowable telehealth modalities, when clinically appropriate to do so. And the person who determines that would be the doula provider who's rendering the services. And so we do allow for obviously audio-visual calls like we're having today. We also allow for telephone calls without the visual, in certain circumstances. I again want to be transparent that we don't today under the program reimburse for text messages. It's something that we also have been asked, it's something that I know on the health plan side, they do it as well. So, these are things that have been actively raised. They're on our radar. On your specific issue, however, I definitely would really appreciate maybe if we could connect offline to talk through that. I'm interested in learning a little bit more about where it occurred and some circumstances, because I do think that warrants a little bit of further follow-up, kind of separate and apart from the policy pieces. So thank you so much.
something that I'm hearing too that's unique about what you shared is that this is a disability and access issue and not just about what policy covers. So, and this is what happens. Like, this is why we talk about implicit bias, and this is why cultural competency matters, because people building things who are able-bodied and English speakers don't think about all the way down to the down to the down to the down, where, how could this be a barrier, right? So I'm noticing, and one of the things we've learned working with DHCS for these years is that there are things that they don't think about because it hasn't happened. And also we're like on the ground, like you said, grassroots providers that are trying to create access in a way that the medical system has been perfectly content to say, well, you're getting your C-section, right? That's enough. And it's been enough for all the years, right? We are a new force that are saying we're actually more responsive to what people need. And this is a new issue. And now they're like, wow, we didn't even know this was an issue. So I'm also hearing like an opportunity for advocacy for disabilities and access. Like, this to me is like separate, connected to DHCS's policy, but like, this is beyond. Somebody who builds policy needs to know that there is an access issue. So this is where like we have, contacted lawyers to understand like where does this start? This decision, and like, is there an exception for a certain population that needs it? And can we get a fast exception now, because people are having babies every day. Babies don't wait for a policy, right? So I just want to acknowledge what you were saying very specifically. And I was recently with a deaf friendly doula who was giving me a lot of information about like the limitations for people who are doing sign language and having birth support, and like how that looks so different than the current way that it's set up to even be able to access. And so I think the doula benefit has been probably like a big wrench in the system, but it's actually been so valuable because I know our teams across the different systems have learned so much about what actual birth needs are, and the system has to be built better to serve that. So thank you for bringing up this, and I just wanted to acknowledge that I heard that request. And yeah, definitely contact, let's stay connected with DHCS, but also there's a feedback form that the community has created so that we can track these things and kind of make sure that when we have the chance, we can lift it up again. So I'll ask you to also fill out the feedback form for the community side so that we could just sort of capture the story too. Thank you.
Right. So thank you for all of those of you who bared with us as we went over time today. I think this conversation is incredibly important. And so we wanted to make sure we allotted, a sufficient time for that conversation. Obviously, there's a lot more to talk about that we didn't get to today, and a lot more problems for us to solve. I think as Amber mentioned, as we were going through the presentation, we were answering some of your very good and hard-hitting questions in the chat. And so did our best to answer those. There are a number of questions that we will need to take back and discuss with other partners because they're not all within our shop and we have to engage with others. And so we'll be working to produce a Q&A document that's responsive and includes the questions here asked today, as well as the questions online so that you all have that information. And again, we'll also be posting the presentation from today on our website as well. This is the first of our Townhall forums. We intend to do this on an annual basis with our partners as we move forward with this benefit. We will continue to meet with our doula partners on a regular cadence to talk through these issues. So we have those stories from how things are working on the ground level. And so again, really want to thank everyone for their participation today, both online and in the room. We couldn't do this without you all, and so we very much appreciate your partnership and look forward to our continued engagement. So thank you everyone for coming today. Really appreciate it. I hope you have a nice rest of your day and a great weekend.